We'll see next about the uses of bedside clinic. What are the uses of the bedside clinic? To show the signs and symptoms related to the particular condition, and through the bedside clinic, we can demonstrate a significant nursing situation also, and to show how nursing problem can be solved, or how we can solve the nursing problem. So these are the uses of the bedside clinic. Next comes, what are the phases? The first phase is the introduction phase. The second phase is called as the patient-centered discussion and the post-clinical evaluation. So in this introduction phase, in the beginning when we go for the clinical setting, we introduce ourselves, then we'll introduce about the client, okay, then we'll have a patient-centered discussion regarding the particular disease condition, the thing which we want to study in the clinical area that we are discussing, patient-centered discussion, and then we'll go for the post-clinical evaluation. So afterwards, we will evaluate and correlate the things with the. So now, what are the advantages of the bedside clinic? As we know that in the bedside clinic, we are directly going to the clinical side or in the hospital, and we are learning or studying on that particular disease. So it is putting the student in an active, actual situation. I mean to say that the student is going to the hospital and he is learning the real things. So it is putting the student actively in the exact or the real situation. And through the bedside clinic, it helps in developing the skills in collecting information from the authentic source. From the authentic source, you can get the information that is the actual source is our patient. So from the source, the student can develop a source, can collect the information, and after collecting the information, he can develop a skill that how he can solve those problems. Next, it helps to develop tactfulness, diplomacy, to get information from the patient. When we are there in the clinical setting and when we are interacting with the patient, the student can develop a tactfulness, how to gather the information from the patient. So wisely he can collect the data from the patient. Next, it will also help to develop the skills in problem solving and the decision making and organizing the things also. Next, it permits the comparison between the reality and theory. As we have already discussed, through the bedside clinic, we are learning the things we are learned in the theory, and that only we are applying it to our real situation. It is permitting how we can compare it. Means how what was the reality in and is the theory. So you have one more question. Just answer the question and proceed. Next, what are the disadvantages? So, what are the disadvantages now? The disadvantages are sometimes the patient is put in a difficult situation. Method of clinical teaching. The nursing rounds. Okay. So now what is nursing round? It is a tour of a patient's bedside area made by a small group of staff and students, not more than 7 or 8, for the purpose of clinical learning and instructional purpose. What is the nursing round? It is a tour of the patient's bedside area. Means a small group of staffs or students, that is not more than 7 to 8 students or a staff. They are going to bed of each patient For what purpose? For the purpose of the clinical learning and the instructional purpose. So there are two types, that is the instructional round and information giving. Instructional round, here where the person is giving the instructions, okay, and in the information we are providing the information about the. Now what are the uses of the nursing rounds? Through the help of nursing rounds, we can demonstrate the clinical manifestation, that means in nursing intervention, and it helps to study patients' response to the disease conditions, and also it helps to demonstrate the effect of therapeutic treatment. Then it will help to illustrate the skillful nursing care. Then we'll have a better understanding of the patient's need in order to provide a better care patient. Next, what are the advantages? So the advantages, that is, it puts the students in live situation where patient responds and acts as a stimulus variable. Then students have options to select specific case or a problem that interests them and plan a proper nursing care, and it provides an opportunity to reinforce the theoretical knowledge in its application in real patient, and helps in increasing the learning ability. Next, the disadvantages. It is only applicable for a smaller group of the students, as I told you, 78, and it requires a careful planning. So, and if there is an exercise for you, you have to list the advantages and disadvantages of the clinical methods of teaching, which I have taught in the today's class. These were our learning outcomes. That is, the student identified and described various types of the clinical methods. Then the student understood the application of the clinical teaching practices. The student identified the learning theory and described the teachable moment. The student described the teaching style and student and the ways to improve their teaching styles. These were the student effective learning outcome that solve the problems with the application of theoretical and practical concept, design the thinking ability, ability to collaborate, and adaptive thinking skills. There are some references you can refer: Communication Education Technology for Nurses by KP Neeraja, or by Suresh Sharma, or by Neelam Kumari. That's all about the today's class, and we'll meet in our next class with some more clinical teaching. Thank you for your attentive listening. Thank you.